For the anatomy section of our DVD, we have called on the expertise of the Wiper Centre of the University of Glasgow. Veterinary surgeons Patrick Pollock and Richard Reardon will now present the anatomy of the lower limb.
Welcome to the Wiper Centre Equine Hospital at the University of Glasgow. Here at the Wiper Centre we see all manner of horses, from Cheltenham winners to children's ponies, and they present for a variety of reasons, both surgical and medical. One of the most common reasons for presenting horses here is lameness. To perform a lameness examination you require a level flat surface and a well-lit area, and for that reason we have this purpose-built lameness hall. An average 500 kilogram horse carries approximately 150 kilograms on each of its forelimbs at rest, and this force triples when the horse is trotting. Horses can reach speeds of up to 45 miles per hour, and the bones, soft tissue structures and joints are exposed to enormous forces during this movement. The equine distal limb is uniquely adapted to its role, not only in weight bearing, but in providing athletic performance. The limbs are designed to act like springs, with the majority of the muscle mass towards the top. The lower limbs have developed to be light but strong. The modern day horse evolved from a small mammal, approximately the size of a fox, with 5 toes, and gradually as this creature's habitat changed from woodland to plains, the animals became taller and evolved to stand on the 1 digit that we know today. This amazing mechanical adaptation has led to a number of anatomical features that are of particular interest to us veterinary surgeons and farriers. Before we start a lameness examination, it's very important to examine the whole horse, and then we gradually focus down on more specific areas. Before we begin the lameness test, we need to understand the correct terminology for the different parts of the horse. When we describe the upper limb, we talk about proximal, and the lower part of the limb, we talk about distal. When we talk about the front of the limb, we refer to the dorsal part of the limb, and the back part of the limb to be the palmar or plantar part of the limb. The inside of the limb here is referred to as medial, and the outside of the limb is referred to as the lateral part. There are a number of joints that make up the horse's limb, and they start up at the shoulder. The shoulder blade is in this region here. It's also called the scapula, and then there's the shoulder joint in this region here. It's quite difficult to see and palpate the shoulder joint because it's surrounded by so much muscle. Then as we move down the leg, we come to the elbow joint, the carpus, the fetlock joint, the pastern joint, and the coffin joint. And we'll talk a little bit more about the anatomical names for those joints later on. Lameness in the front legs is slightly more common than lameness affecting the hind legs, and this is perhaps because the horse carries a greater proportion of its weight on the front legs. Many horses present with lameness, and the owners believe the lameness to be due to a problem in the upper leg. In fact, 80% of lameness is confined to the distal limb or foot, and that's one of the reasons that good farriery is so important. We're now going to take a closer look at some of the internal structures of the lower limb of the horse. Equine bone is a unique structure in that it grows continuously through life. This is the radius, an upper limb bone from a foal. You can see it has a long shaft and a joint at either end. This line at the bottom of the bone is the growth plate or physis, and it's from here that the bone grows by elongating. The growth plates close at different time periods depending on the age of the horse, with the growth plates in the lower limb closing when the animal's younger. For example, the growth plates below the fetlock have really no useful growth after about 10 weeks of age. And this means that if there's a problem with the lower limb, such as a deviation, it's very important that it's treated before the growth plate closes. Here are the bones of the horse's lower limb. Depending on whether it's a front leg or a hind leg, the terminology is a little bit different, but basically below the hock or the carpus, the bones are very similar in the fore and hind limb. This bone is the cannon bone. In the forelimb it's called the metacarpal bone, in the hind limb the metatarsal bone, and this is the third metacarpal or metatarsal. There are also 2 smaller metacarpal or metatarsal bones which are known as the splint bones. And these are in fact the remains of the digits from the days when the horse had more than 1 toe. The cannon bone is a long straight bone. It takes most of the force in the horse's limb, and it attaches to the next bone down at the fetlock or metacarpal phalangeal joint. This is a high motion joint where most of the flexion and extension comes when the horse is moving at any kind of speed. On the back of the fetlock or metacarpal phalangeal joint, there are 2 smaller bones or sesamoids, and these bones are important to allow the soft tissue structures or tendons to flow over the back of the fetlock joint. The next bone is the first phalanx, or long pastern bone. It's a slightly shorter bone than the cannon bone, but again, a lot of the movement in the lower limb comes from this position. The next bone down is the short pastern bone, or second phalanx, and it attaches onto the first phalanx at the pastern joint, and the correct name for that is the proximal interphalangeal joint. Moving on down the leg, we have the articulation or joint with the lowest bone in the leg, which is the pedal bone. This joint is called the coffin joint or distal interphalangeal joint. And again, there is a sesamoid bone which allows the tendon or soft tissue structures to move over the back of the limb. And this sesamoid is called the navicular bone because it's shaped a little bit like a boat. The lower bone, the third phalanx or coffin bone, is contained in the hoof capsule. Concentrating on the pedal bone or third phalanx, you can see that it's a rather unusual shaped bone. It has a fairly semicircular edge, and it has a number of holes in both sides. These holes are called foramina, and blood vessels pass through these, so the bone looks a little bit porous. You can see it has this large protuberance on the front. This is the extensor process, and then this flat area here is the articular or joint surface, and it's normally covered by articular cartilage. These two protuberances here are the palmar prominences, and on each side of them, in this position and this position here, there are cartilages called the collateral cartilages, and in some horses these become gradually ossified or bony in response to age and perhaps increased concussive forces. The entire bone is encased in the hoof capsule, and the attachments between the bone and the hoof capsule are very important and involved in a number of disease processes.
Having looked at the bones of the lower limb, I'd like to go over an anatomical specimen. At the top part of this, you can see the fetlock region, moving down to the pastern region, and then the hoof itself. At the top of the hoof, you can see the coronary band, this region here, from where the hoof wall itself is grown. The hoof wall is made from horn, which is essentially like human nail, and is grown from papillae, which grow from the coronary band down towards the ground surface. The hoof wall grows at approximately 1 centimetre a month. If we turn the specimen to show you the solar surface, you can see the hoof wall, you can see the frog, and you can see the concave sole. These are all made of horn. This horn has differing water contents which affects its elasticity, the frog having the highest elasticity. The junction between the solar horn and the hoof wall is this line here, and this is called the white line. This structure here is the bar, and this region here is the seat of corn. Having looked at the outside of this specimen, we'll now have a closer look at the internal structures. Looking at the bony structures first, we start here with the distal end of the cannon bone, where it joins onto the long pastern bone, this articulation being the fetlock joint. Moving down the long pastern with the short pastern being the pastern joint, and then the short pastern with the pedal bone being the coffin joint. This bone here is the navicular bone. And now to focus in on the joints, in this instance the coffin joint, you can see as the bones articulate there is cartilage on the ends of the bone. This is articular cartilage, and this acts as a shock absorber in the joint. The joint is surrounded by a joint capsule or synovial membrane. This produces synovial fluid, which helps to lubricate the joint. It is known that damage to the synovial membrane can be very important in the formation of osteoarthritis. Joints are held in place and supported by a variety of collateral ligaments. The lower limb is also supported by tendinous structures. Along the front of the limb, you have extensor tendons, and along the back of the limb, you have flexor tendons. In this sagittal section, you can see a nice deep digital flexor tendon that runs along the back of the fetlock joint, down the back of the pastern, across the back of the navicular bone, and inserts onto the pedal bone at this level here. Concentrating on the foot, you can see the solar horn, which is this structure here, extending into the frog. Above the frog is a digital cushion, which is an elastic shock-absorbing structure. If we move towards the front of the hoof, you can see the dorsal hoof wall, and as that attaches to the solar horn, you can see the white line at this level here. You can see this structure here is soft tissue laminar structure, and this is how the pedal bone is attached to the dorsal hoof wall. In conclusion, with this post-mortem specimen, you can see the fragile laminar attachments between the bony structures of the leg and the hoof capsule. These longitudinal structures on the pedal bone, extending from the coronary band to the sole, are called laminae. On the pedal bone, they're called dermal laminae. On the inside of the hoof capsule, there are also laminae. These are called epidermal laminae. These laminae interdigitate with each other and form an exceptionally strong bond that supports the weight of the horse.